So open up your screens because I'm so much used to the morning time, you guys chirping, wishing me good morning, doing thumbs up. Neha, Deepa, it is okay if you are not dressed up, like at least open up your screen. Vimy, your hair is looking just perfect. And it so good to see you, Vimy, because she is from Singapore and I know right now it is pretty late there. I think almost 12 o'clock, right? So almost 12 p.m. Yeah. So good to see you all. Uh, Continuing with our week about gynecology, Akanksha, a very warm welcome to you.
Thank you. Thank you so much. Yeah.
And so before I speak about anything regarding infertility or miscarriages and what exactly is the metaphysical connection to that, I would like to offer the platform to Akanksha and then take it from there onwards. So Akanksha, platform is all yours.
Thank you so much, Sangeeta. And just before I start, and yesterday because I was on phone, I couldn't see anybody, and I think I went too fast with everything. So I'm happy to like you interrupt me in between if I'm going too fast. So please stop me. And if you think anybody has any questions, right in the middle of something, if you think there's something relevant you want to say, please raise your hands, and it'll be good to have talk about what you want me to talk about rather than me just saying what you don't need. So,
So one sec, I'll first inform all of them. So the session will be little different. It is not about Dr. Akanksha will go on explaining you medical terminology. You guys have any problem, you have any questions connected to that, whether it is the medical perspective, metaphysical perspective, please feel free to raise your hand and speak about it. If she is in between a point, we will wait till she finishes the point and Mehak will unmute you and you can ask your question to her. So please feel free if anyone does not understand so much of medical terms or if you do not understand so much English, please feel free to ask that in Hindi as well.
yeah, and I'll speak in a mix of language today just to keep it a little bit more simple. Okay. All right. So, good evening, good morning, good afternoon, everyone, wherever you are. And today's topic is for me to talk about infertility and miscarriages. And it is a very, very vast topic, and I really cannot go into depths and breadths of it. So, what I'm going to do is I'm going to briefly explain how basically babies conceived and at what stages the problems can be and how it can impact our like life otherwise and how events in our life can actually affect our fertility, so just how they are linked to each other. So basically medically we say that we should start investigating for infertility uh, under the age of 35. So this is age of woman. So under the age of 35, if you've been actively trying to get pregnant for 12 continuous months. So in India and in our culture, I think it's very common ki shadi hui and 6 mahine baad everybody will start asking on good news kabari, good news kabari, and it really puts a lot of pressure, especially on the female, even though infertility is a problem of a couple. And here in the Western society, we look at it, we also like bring couples to the clinic and we talk together to them. But in India, it's usually the female who's going to the gynecologist alone, and she takes all the social brunt and the medical brunt of the situation, even though the problem might not be her. So that's a very different kind of perspective that is there in different parts of the world for the same thing. So the first thing I wanted to emphasize was that at the age of 25, if you're in a new relationship or a new marriage and you've tried for a few months and then you didn't think you were ready for it, and then you tried again for a couple of months and then you said, okay, let me try, and then I'll do my PhD first and then I'll try. That doesn't mean that you've been trying for 2 years. It has to be 12 continuous months of unprotected sex, and then only we medically would say that yes, you need investigation. So I just wanted to emphasize this again and again कि बहुत जल्दी investigate करना is also not good for your psychology, and you're not going to find anything and it's going to stress you out. And obviously you should not wait too much as well. If you've been trying for 1 year and it hasn't happened, then it's reasonable to seek medical help. If the woman's age is over 35, then we bring this to 6 months rather than 1 year, because naturally the biological clock is ticking and the chances of conception do go down, and there is a bigger chance of finding a problem at that age, because some women will have fibroids, some women will have other medical problems, and they might need to be addressed a little bit sooner. So we say if you have tried for 6 months continuously over the age of 35, you should seek medical attention. And this has also become very important because the peak of fertility, actually biologically or medically, is at the age of 24. So even though women are fertile from when they start menstruating till they get menopausal, the peak of fertility is at the age of 24. And in today's world, there are only very few women who are actually trying to get pregnant at that age, or everybody at that age is like, abhi 25 ke bhi nahi hue, we don't want to think of it. So that's really important to understand that it's not just the social, biologically the eggs start to age. So the chance of getting pregnant goes down after the age of 35. If you do get pregnant, the chance of having a miscarriage goes up, and the chance of the baby having a genetic abnormality goes up. So obviously it's not just on the 35th birthday overnight things are going to change. Obviously it's goes on slowly, but that is an important landmark to remember. The other thing I wanted to touch upon was the causes. So in about 1/3 of the cases, we see 1/3, 30 to 40% of the cases, we find out that it's a problem to do with the female actually. And the problem could be at various levels, which I'll just discuss shortly. In 30 to 40% of cases, it's actually the problem is with the male partner. And the problem with the male partner can also be multifold. It can be medical, it can be something to do with the sperm count or sperm quality, or it can be that he's on some medications which is making his sperm bad at that particular time, or it could be doing with his lifestyle as well. So a lot of times, and that proportion of the males being affected is constantly being increasing. So if we see like the demographics of it, if we just take like normal sperm quality of males 50 years ago was much better than the sperm quality of the males in today's world. And that has a lot to do with lifestyle and the pollutants that are there in the processed food. So it is important to recognize that 1/3 of the cases, it's not the female who is a problem. And the remaining 1/3 of the cases, about 30% of the cases, we actually don't find anything. So there could be that there is some immunological problem or some problem which there are no tests to test for, or sometimes it's just bad luck that it hasn't happened. And if they keep trying for maybe longer, 2 years, 3 years, they will get pregnant at some point, that couple, but it just hasn't happened yet. So it's important to recognize that unexplained factor. And those are the cases where we really need a very good psychological and social support as well, because they know there is a problem. We cannot find out a problem, but obviously we want a solution. So I'll go back to from the problems that can happen in a female. All right, okay, till now, any questions anybody wants to ask?
No, so Akanksha, I mean, there is no question, but I just wanted, there is so much of lack of understanding or knowledge in people about it. That, I mean, kisi ko pregnant hona hai, somebody wants to be pregnant, so these are the steps ideally they should have done. Everyone knows that, once they want to get pregnant, then they get that urine test done and probably blood test and that much. But there are strips for ovulation day also that they can measure. They know exactly what day. So I think the knowledge is also like awareness is missing in people. Is there anything in particular for men and women both?
Yeah.
जिनको I mean they have to be careful for it from beginning. जैसे हम बोलते हैं ना सिगरेट नहीं पीना है lungs खराब होंगे.
I'll come to that in like the 5 minutes or so. Yeah, that's great. Thank you. So I've just got this little diagram with me. So these are just the parts of the female reproductive system. So this is the ovary. So we have two, one on the left and one on the right, from where the eggs are formed. These eggs need to be picked up by this tube and they travel down, and the sperm will come from down below after sexual intercourse and they meet somewhere here in the tube, both of them. And then the so-called early baby, we call it embryo or a zygote in medical terms, that actually then comes back to the uterus and implants itself here. So the problem can be anywhere. So the problem could be that the egg is not coming out. The problem could be that the tubes are blocked, and that's why the eggs are not going to the right place. Or because the egg actually, once it is released, it only stays in the body for 48 hours. So the day you ovulate, the egg is only active for the next 48 hours. And if at the right time, sexual intercourse doesn't take place, even if somebody's had regular sex throughout the month, they are not going to get pregnant because it has to be at that time. And then finally the embryo has to come back, and if there is some problem with the womb, like in India, it's very common to have tuberculosis. So if somebody's had tuberculosis in the past, or endometriosis or other problems with the womb, they have a polyp or they've had fibroids or anything, then that embryo will struggle to implant itself here as well. So these are the basic problems that can happen. And obviously, treatment will be dependent on the problem that we find. So we cannot be like everybody should take those medications or everybody should be taking those kits as well. These kits are basically available in the market. They tell us if there is an ovulation or not. So actually using the kits, I tell my patients, if you use the kits, you are going to be more stressed about it. That, oh, I have tested and oh, now there is an egg, why we have to do it now. So it's actually puts more stress on the couples. So my best advice is, if it's a regular monthly cycle every 28 to 30 days, if the couple have like alternate day sex from day 10 to day 20, they are going to be at the right time. So I know with the busy lifestyles, it's not very possible, but I think for 1 week or 10 days, it's worth the try. Rather than going through all the medical treatments and investigations, it's easier to find that time rather than then running to hospitals. And using the kits, even though it's very attractive, I would say, and maybe it's reasonable to do it once to find out whether you're releasing an egg or not. But if you found out that you are releasing an egg every month, then it's better to just leave it at that and then just go for like regular intercourse in that fertile period, which is the middle of the cycle. So if it's a 30-day cycle or a 28-day cycle, then we say from day 10 to day 20 is the best time to actually try for pregnancy. And the other thing, like Sangeeta mentioned about what are the things we should be aware about. So generally, it's to be healthy and be good. When we say be good, less processed foods, at least 5 fresh fruits / vegetables, whatever, even if you can have any fruits or vegetables, fruit juice, anything, something fresh, which is not frozen, which is not processed, which is not fast food. So you should have at least 5 items of that. Obviously, weight optimization, it goes for females and it also goes for males. So there is a lot of interesting research going on currently in the labs in Europe and the UK as well, that they have taken, fat mice and they found their eggs, and mice which were not so fat and they got their eggs. And actually the fertilization rates was high in the mice which were not fat. So it's beyond, what is happening. So there are things we don't understand, the medical science actually doesn't understand, but it goes a long way. Weight optimization and physical exercise, it goes a long way in synchronizing the body hormones and in improving the chances of fertility as well. And then lifestyle advices, like Sangeeta also mentioned, obviously cigarettes are a complete no-no. E-cigarettes without nicotine, yes, people argue we can use some, it doesn't got the nicotine, can we use it? Well, it's better than the one with nicotine, but it's never a complete safe thing to do. I'm always against it. And alcohol, of course, if you can completely cut it down, it's the best. And if you find out you're pregnant, then obviously do not take even one drop. That's the best solution. But if you are a light drinker, if males who are light drinkers, and if they're consuming less than 3 to 4 units of alcohol per day, that is something which is considered permissible, if you like. So that is something which can be permitted. Limiting caffeine also has a role. So not more than 2 cups of coffee / tea in a day is something we recommend medically to keep keep the hormone balance in place. So fitness, physical exercise, diet I have mentioned, and obviously any recreational drugs as well are a complete no-no. Also, if there are certain medical problems, so if somebody is diabetic, or if somebody has got thyroid problems, or if somebody's got some other problems like Crohn's disease, digestive problems, renal problems, and they are on some medications for the disease, then we have to look into whether those medications are actually safe in pregnancy or not. And if not, is there a safer alternative available? There are some medications even for males, like for psoriasis or some other conditions, males are on methotrexate, which is a medication which can really impair the sperms as well. So it's important to check the medications that the male is taking and the female is taking to optimize their medications before they actually start to try for pregnancy. So that is also something that you should look at, like even before you get to that point of 1 year of having tried and not got it. But I think medication optimization is something we should look at from the start. And yesterday also we mentioned even for the menarche, for menstrual cycles in young females, it's weight optimization goes a long way. So the healthy BMI, that is body mass index, it should be under 25. And even if it's under 30, it's okay. But once it goes over 30, it can really start to affect the reproductive system, and it can really reduce the chances of getting pregnant as well.
So, Dr. Akanksha, I have witnessed many clients where they have been to a lot of medical tests. And that point of time, like for some of them, everything comes normal, and still they are not being able to conceive. So according to like the medical fraternity, what percentage do you attribute to their stress levels, their mental pressure levels, or something you really desperately want to have, and that is something which blocks you from having it?
So I think it's a vicious circle. So because somebody's not able to get pregnant, they start to get worried, and because they start to get worried, their hormone balance goes out of sync, and they cannot get pregnant, and that puts them in more worry. So it's a vicious circle, and it's really bad to get into that circle. And obviously, especially with the social pressures, it gets really bad. If you're asking me for evidence of stress levels, so they have done some interesting studies where there is a hormone called cortisol, which they can measure in your hair. So if the stress level is high, the cortisol goes high. If you pluck a hair, you can tell, because the hair grows at a particular rate, like about 1 centimeter in a week or something like that. I might be wrong, but something like that. So you know that this strand of hair at this stage was corresponding to that month of the year. So they have tried measuring the cortisol levels at various levels. It has shown a positive correlation, definitely, because there is no other way to measure stress. You can say, thoda sa stress hai ki bahut zyada stress hai. How do you measure it? Ki itna ho gaya ki it is affecting me, medically. So they tried doing this very interesting experiment, and they did find that it did correlate that if when the women who were infertile had higher levels of cortisol in their hair, but obviously we can't say how much is bad because we are all different and we all perceive stress differently. So किसी ने आके बोल दिया चलते फिरते वर्क प्लेस पे ओ अभी तक बच्चे नहीं हुए and somebody will be like हाँ नहीं हुए तुझे क्या करना है but somebody else might really sit and cry about it at home. So it is totally dependent on how you perceive it. So it's difficult to gauge that effect of stress. But I think we are also different, but it definitely does affect the system.
That's very interesting. So they're required to give the hair to the laboratory, or you yourself can check?
No, they check it in the lab. Yeah.
Because I think every day then everybody will be picking one hair to check okay how stressed you are.
They don't even do it in routine hospitals. It would be something in research setting that they would do.
And majority, I think the husbands will say as it is they are balding, and then wives are picking up one hair and checking, let me check your stress level. I think that would be very funny and very interesting. So anyone has any questions first before we speak any metaphysical aspect about it? Nobody has any question? Anything that you would like to know about infertility? Anything you would like to know about the miscarriages? Okay. Dr. Akanksha, causes of miscarriages, Mrudula is asking.
So causes of miscarriages can also be multifold. So it is like seed and the soil. So seed is the embryo and soil is the womb where it has to implant. So it can be problem with the womb where the implantation is not happening or problem with the seed. Most commonly, if it's a sporadic miscarriage, like only one miscarriage has happened, then most commonly it is to do with the genetic problems in the baby. So the body kind of recognizes that this is not going to be a healthy pregnancy. There is a genetic problem there. And even though it starts that pregnancy, it rejects it after one point. So that's the most common thing in sporadic miscarriages. But when the miscarriages are happening repeatedly, like 2, 3, 4 miscarriages have happened, then it's more to do with something's wrong with the womb. It could be that it's wrong with the womb shape. There could be like a septum or a fibroid there, or sometimes it can be to do with the hormones like thyroid levels or prolactin levels are not right. And sometimes it can be a problem of what we call as a sticky blood screen. So sticky blood, basically these are some problems with the blood where blood tends to become a bit more sticky and it doesn't let the embryo implant itself. So there are treatments for a lot of these things available, but yeah, it needs to be investigated a lot thoroughly if more than one miscarriage has happened.
Nice. Anyone else? Any question that you guys have? Yeah, I do not see anyone raising their hand. So just briefing a little bit about the metaphysical aspect of it, because when it goes to metaphysical understanding with infertility and miscarriages, it is quite huge. And so the metaphysically, what we believe is that the conception is the most beautiful thing, or the garb mein aana is the most beautiful thing which can ever happen. Brudra is asking effects of abortion. So Brudra, since I've already started, let me just complete and I'll hand over to Dr. Akanksha. And so metaphysically, they say that even after the woman conceives, it is actually the 4th day of the 4th month when the soul enters the womb. Till then, it is like a rental place for the soul. Soul has booked the womb. It comes and it goes. It comes and it goes. And that's why the first trimester has been said that, the chances of miscarriages are like much more than before. Again, metaphysically, it has been said that it is never the parents who chooses the soul of the child. It is always the child who chooses the parents for a reason. So the minute one of them have decided that they want to conceive and the child has decided, it's sort of an energy matching. And many times these children and parents are found to have contracts between them as well. So, I mean, something as simple as, for example, if a mother is thinking of not being happy in a marriage and something, and but the child has a contract. So the child's soul has a contract to be there as a safeguard, to be there to give life to her. The child chooses to enter into her womb so that there is a new life, and the mother chooses to survive and chooses to continue with her life form and all. uh, I have worked with a lot of cases of, like, I mean, people having problem, the gynecological problem and all, and with a very successful rate. So in fact, one of the case where theta healing, what we teach, the genetic work, and uh, she never got her periods from before, and the hospitals had said that, that she will never get it, and it's a complete ovarian failure. So the sonography would show only one ovary proper, and the one side of ovary was completely shrunk and hardly be seen. And after a lot of belief work and the past life regression, and we actually identified from the report which gene is responsible for that, and we activated that. And the next report, like the last session, we got the message that now wait for some 3 months. And after 3 months, like when she had gone to the doctor, like she got her first cycle at the age of 35. And when she went there, there was a complete like ovary regeneration had happened in the sonography. So these are, like, what in the layman term, we may call it miracles happening and all. But this does.
Interesting. It's very interesting when you said that the soul enters at you said fourth month, isn't it? So actually, medically, we think that definitely the miscarriages are more in first trimester, and 90. So I tell my patients, because we see them very routinely. So I tell them, once you cross the 12-week mark, we are in a safe zone, because the chance of miscarriage goes down from being 90% for those ladies who've been having repeated miscarriage to as low as 5%. So it's a very important landmark medically as well, to cross that first trimester. And for us, our understanding, like from medical perspective, is that there is no placenta. So at that stage, the proper placenta has not formed. So proper nutrition has still not started going to the baby. Is still surviving on like various juices from the mother, if you like. So he's not getting proper food till then. And that's the landmark from 12 to 13 weeks when the placenta takes over. So it's quite interesting to see that that's when you say that the soul enters, and that's when then definitely the chances of miscarriage are extremely remote once you cross the 12-week mark.
Yeah. And Dr. Akanksha, can you just throw some light on Mridula's question of what are the side effects of the abortion?
Yeah. So thanks, Mridula, for asking. And there are the effects can be different. You know how it is dealt with, at what stage it happened. So sometimes the pregnancy is so early on, like you've just missed your period and you tested positive and you started bleeding immediately. Then obviously it's just come and gone very quickly. So it doesn't really affect the womb in any way. The chance of abortion affecting the womb is more if you have to have a surgical evacuation, which we call DNC. So if you have to have a surgical procedure, that can sometimes damage the wall of the womb, and that can affect the chance of you getting pregnant later on. So that's the main kind of medical effect. Otherwise, one pregnancy, one miscarriage does not affect your next pregnancy in any other way. It's not that. So I keep telling my patients as well that even if you've had 4 miscarriages, that doesn't have any bearing on next pregnancy, because it's a fresh start for the womb. So unless there is a problem which is lingering on, like obviously if there is a thyroid problem, it can affect, but the previous miscarriage has no association with the next pregnancy unless there is a genetic thyroid problem or something like that. So it's only in cases when there has been a surgical procedure done that it can affect the womb in a way that is harmful. Obviously, it has a lot of bearing on how women perceive it, because for women, it's like losing a part of them and they never got it. So I think they struggle emotionally a lot to come out. And I also always advise women to wait for at least 3 months before starting to try for next pregnancy, because they are in so much pressure कि एक miscarriage हुआ and फटाफट अगले महीने में they're trying to get pregnant. I think it's very wrong because you've not recovered from that episode. And medically also, if we want to recover all the blood loss, the life cycle of the blood cells is about 3 months. So in 3 months, you would have recovered your blood loss, you would have recovered a little bit emotionally, not completely. And I think you're in a better place to start trying.
I think abortion has a huge psychological and emotional impact on women, because somewhere, it just leaves a mark on them. And like, obviously, like physically also, they become little, they feel little weaker at that point of time. But psychologically, I think that imprint does not go out so soon. Metaphysically, like, we feel that is a contract between the child and the mother. And probably, the child chose for that contract, or there's a sense of rejection. So
I feel that early losses are still better, kind of. Women tend to cope better if it's an early loss. But if somebody loses a pregnancy in fifth month or later stages, then obviously you form that little emotional bond with a life inside you, and then it's even more difficult. And I think it's always reasonable to give yourself a bit of time and not come under that social pressure to start trying for the next pregnancy right away.
yeah. So I think somebody asked on the platform that I spoke about soul choosing the parents. How do you find it? More than, I mean, you do not require to find it. That's a fact. And more than that, we identify the obligation or a contractual obligation, if there is there, between parent and child, which is blocking either any one of them. In that case, you really want to identify and focus more on why did this child chose this set of parents, and why these parents chose to serve the child. So this happens whenever the child is born with a defect, and you want to identify the contractual obligation and release both the parties from that contractual obligation to allow the child to be healthy and fine, and to allow parents also their normal routine. And if you're learning detailing, then obviously, like, when you start seeing back in life, like if you are either like seeing your past lives, or you connect in the theta frequency, and you can ask, what is my obligation, and why did this child chose me? Whom did this child chose, like the mother or the father or both? And if they chose, what was the reason of them choosing us? And when you identify that, you require to identify that, are your children there to serve you? And if they are there to serve you, do you want to really continue with that, or you have understood that you are capable of carrying it forward, and you can release the child from that obligation? So many times it is a very blocked energy for either for the child, or for, because many children actually have a purpose of life just to be there for mother or father, and which I feel is not a very good idea for a child to have that, or not that parents will also be happy. So this requires either you to take a session, or when you have learned it, you require to ask all these multiple questions and identify that complete equation, and establish that equation, and start clearing what is not meant for your good or for the child's good, or whatever is blocking both of them. I hope that answers your question. Yeah. What
I
about
also wanted to just mention that we speak about the emotional baggage that women carry and the effect it has on them. And sometimes, especially in India, when the females are only being seen by the doctors, it's in today's world. I think it's also the male partner who actually goes through a lot. And sometimes it's because they are supposed to be tough and they don't speak up, and they are just left they also need a little bit of counseling, I think, sometimes, because even for them losing a child means something. And sometimes, they also need a little bit of support, because just instead of supporting the female, I think they also need a little bit of care. And there is a huge impact of infertility and miscarriages on the relationships. I think the relationships tend to become very strained, and it's not uncommon to see people breaking off because of these things. So I think somewhere the role of counseling and the role of clear discussion goes a long way in keeping those equations right.
Yeah, so we'll just take the last question, what Mrutula had asked. What about the metaphysical aspect of stillborn children? Yeah, so there are two aspects attached to that, depends for that soul. But either the soul was there only for that short time and that was the contract, and some other lifetime they had that I will be there in your womb, and it will be there. And many times it is the trauma uh, which is causing the child to be born as a stillborn. So it is not something which is like a generalized term metaphysically that we can identify about it. The point here is that this is not written on stone. You can change it. Neither infertility, nor your miscarriages, nor abortion, like the one requires to look at it from a very holistic perspective. And when I say holistic, which means you do take care of the medical aspect and metaphysical aspect as well. So friends, thank you so much for joining, and Akanksha, thank you so much. Your downloads are pending. We will do it tomorrow or on the Friday since we are already overstretched with the time. And thank you so much. See you all tomorrow. If you have any questions, please put it. Thank you with lots of gratitude.
Thank you so much for attending the session, and we'll see you tomorrow now. Thank you very much.
Thank you. Bye.
Thanks.